liaison psychiatry. Can you all hear me? First EMI theme is teratogenicity. Choose one option for each question given below. Question number 1. A 30-year-old woman suffering from bipolar affective disorder has been on remission for a long time on lithium. She has a family history of Down syndrome. What is the most important adverse effect you will warn her about if she is planning to become pregnant? So what is the answer? The correct answer is B, Epstein's anomaly. So in Epstein's anomaly, there is displaced tricuspid valve, which allows blood back into the right atrium. This is one of the important anomalies seen when lithium is taken during pregnancy. The maximum risk is at 2 to 6 weeks after conception. Next question. A 33-year-old woman is suffering from a hypomanic episode. She has a long history of bipolar affective disorder. After improvement, she is now maintained on sodium valproate. What is the most important adverse effect you will warn her about when she is planning to become pregnant? What is the answer? Good. It's neural tube defects. Okay. Sodium valproate is the most teratogenic drug. The risk of any birth defect quoted is 7.2% in Morsley, but North American registry quotes about 10% risk. The risk of neural tube defect is about 1 to 2%. So answer for question number 2 is H. Question number 3. A 27-year-old woman who is 5 months pregnant now is depressed. She has a past history of depression and a family history of depression. She had a good response to paroxetine and insists to continue paroxetine during this episode. What adverse effect will you warn her about? So, paroxetine consumption, what adverse effect will you warn her about? It's cardiac malformations. Correct. Paroxetine, particularly high-dose first trimester exposure, is clearly linked to cardiac malformations, particularly VSD and ASD. So answer for question number 3 is J, cardiac malformations. Next theme, movement disorders in psychiatry. Question number 1. A 65-year-old woman presents with short strides, short stepping gait, and progressively small and cramped handwriting when tested. She has a vertical gaze problem on examination. What is the disorder she has got? She has got Parkinson's disease. Yes, the correct answer is F, Parkinson's disease. So patients with Parkinson's disease usually have short strides, short stepping gait, and progressively small and cramped handwriting. So answer for 1 is A. Question number 2. A 15-year-old boy develops non-repetitive sudden movements of his arms. He has no past history of similar problems, and the family has no degenerative illnesses. The only medical history seems to be an episode of pharyngitis nearly 6 months ago. So what do you think is a possibility? This boy has got features of Sydenham's chorea. The answer is A. So in Sydenham's chorea, often there is history of pharyngitis, and the person is usually infected with beta hemolytic streptococcal infection. If it is left untreated, the person will go on to develop Sydenham's chorea, which is characterized by rapid, uncoordinated, jerky movements, primarily affecting the face, feet, and hands. So answer for question number 2 is A, Sydenham's chorea. Question number 3. A 45-year-old man has a history of progressive memory loss. His wife has observed him having sudden muscle movements on a number of occasions, as if he's experiencing an electrical shock momentarily. What is the diagnosis? So these are features of CJD. Okay, patients who have CJD experience myoclonus, which are brief asynchronous muscular jerks of the extremities. For the patient, they may experience like an electrical shock. Okay. The other clue is the patient also has history of progressive memory loss. The memory loss progression is quite fast in CJD. So answer for question number 3 is I, Creutzfeldt-Jakob disease. Next question. A 37-year-old woman has repeated involuntary blinking and chin thrusting. She is cognitively intact and has no other movement problems. She constantly uses chewing gums to conceal her facial movements. So what is the diagnosis? The diagnosis here is Meek syndrome. Okay. Meek syndrome is a type of orofacial dystonia characterized by involuntary blinking, chin thrusting, lip pursuing, and tongue movements. In terms of etiology, the primary etiology is idiopathic, but sometimes it can occur secondary to movement disorders like Lewy body disease, and when patients take medications like levodopa. It is often seen in women in middle age. These abnormal movements, dystonias, usually disappears with sleep. It is treated with Botox injection and carbamazepine. So answer for question number 4 is D, Meek syndrome. Question number 5. A 57-year-old gentleman presents with long strides and quick involuntary knee flexion. He has history of seizures and cognitive impairment. What is the diagnosis? These are all features of a rare condition called as neuroacanthocytosis. In neuroacanthocytosis, the person may have abnormal spiked red blood count in their blood. Neuroacanthocytosis occurs due to atrophy of the caudate and putamen nucleus. The patient can present with seizures, and they can also have dementia, which is probably of subcortical type. They present with movement disorders like tics as well as chorea. They have characteristic gait. It's called as lurching gait, which are abrupt, unsteady, and uncontrolled movements with long strides. So these are all features of neuroacanthocytosis. So question number 5, the correct answer is C. Next theme is investigations. Number 1, a 35-year-old gentleman is presenting with fever, abrupt onset confusion, and behavioral changes. So what will you do? What do you think is the diagnosis? The diagnosis for this gentleman is herpes simplex encephalitis, fairly abrupt onset of confusion, memory impairment, fever, and behavioral changes are all features of herpes simplex encephalitis. 70% of them show behavioral changes and also psychiatric disturbances. Fever is common but not invariable. Among the investigations, MRI scan provides the most sensitive method of detecting early lesions, and that is the imaging of choice in herpes simplex encephalitis. So when you do MRI brain scan, you can find changes in the temporal lobes. If you look at the picture shows patient with herpes simplex encephalitis where there is hyperintensity involving the right temporal lobe. So MRI provides the most sensitive method of detecting early lesions in herpes simplex encephalitis. So answer for question number 1 is B. Question number 2. A 75-year-old man who suffers from late onset psychosis has been on risperidone. He develops Parkinsonian symptoms, and the neurologist says that this could be drug induced. So what will you do? This patient probably is a case of Lewy body dementia, presenting initially with psychotic symptoms and later developed other features like motor symptoms of Parkinsonism and neuroleptic sensitivity. In these situations, the useful investigation would be DAT scan. DAT scan uses SPECT technology and can be undertaken in most imaging departments. So if you look at the DAT scan picture, if the scan is normal or if they have possible essential tremor, then the comma shape of the basal ganglia is retained. But if they have abnormal scan, then it's usually period shaped, which helps to differentiate whether the person has got Parkinsonian symptoms or essential tremors. It is also helpful to differentiate whether the person has got Lewy body dementia or Alzheimer's dementia. If it is Alzheimer's, there will be no change. If it's Lewy body, again, they may have period-shaped lesions in the abnormal scan. So answer for question number 2 is E, SPECT scan. SPECT scan is helpful to find out the question number 2. The answer is E, SPECT scan. DAT scan uses SPECT technology. So in some exams, they've directly asked DAT scan. If it is not there, please mark SPECT scan. Question number 3. A 46-year-old gentleman comes to your outpatient's clinic as he is transferred from another area. He has a history of schizoaffective disorder. He is on quetiapine 700 milligrams per day and is also taking amitriptyline 75 milligrams per day. So what will you do? You have to take ECG. Okay. Most psychotropic drugs such as quetiapine and tricyclic antidepressants like amitriptyline are associated with ECG changes, particularly QTc prolongation, and are casually linked to ventricular arrhythmias and sudden cardiac death. Therefore, ECG monitoring is absolutely vital in such cases. The answer for 3 is HECG. Question number 4. A 39-year-old woman has a history of bipolar disorder and is on sodium valproate 1000 milligrams per day. She has developed nausea and abdominal pain radiating to the back. So what will you do? You have to do a CT scan. Sodium valproate can cause gastric irritation and hyperammonemia, both of which can lead to nausea and vomiting in the patient. It can also cause pancreatitis during which the patient can present with abdominal pain radiating to the back. The investigation of choice to detect pancreatitis is CT abdomen. So answer for 4 is A, CT scan. Question number 5. A 55-year-old man with chronic schizophrenia is on 750 milligrams of clozapine. His carer noticed him to be confused and has bite marks in his tongue. So what is this? Clozapine on high doses, when you cross more than 600 milligrams, it can induce seizures. The patients may have generalized seizures with loss of consciousness, tongue biting, and also incontinence. So in such situations, EEG would be helpful to look for any epileptiform activity. So answer for question number 5 is G, EEG. EEG, sorry. Next theme, endocrine disorders. Question number 1. A 30-year-old woman presents with hyperpigmented buccal mucosa. She has also lost weight of late, which she considers on a positive note. She reports some nausea in the mornings, abdominal pains, feeling dizzy on and off, and feeling confused at times. So what do you think is the type of endocrine disorder this is? These are all features of Addison's disease. Answer is A. So when patients have Addison's disease, they have hyperpigmented buccal mucosa. So hyperpigmentation is a feature seen in Addison's disease. And patients can develop hyponatremia. So when they have low sodium levels, they can develop nausea and vomiting, abdominal pain. They may have dizziness on and off. In extreme cases, it can also lead to acute confusional state. So answer for question number 1 is A, Addison's disease. Question number 2. A 55-year-old woman presents with weight loss, foul-smelling bulky stools, abdominal pain, mouth ulcers, and vomiting. Pathology shows villus atrophy on jejunal biopsy. What is this? This condition is celiac disease. Good. The correct answer is celiac disease E. So in celiac disease, the patient can present with villus atrophy. So this is normal intestine with villi, and in celiac disease, you can find intestinal villus atrophy. That's an important feature of celiac disease. And in clinical presentation, they may have abdominal pain, steatorrhea, bloating sensation, nausea and vomiting, mouth ulcers, and also weight loss. Okay. So answer for question number 2 is E. Question number 3. A 24-year-old lady has weight loss and irregular periods. She also has tremors and frequent stools of normal consistency. She's not comfortable with the heating even in the coldest of days. So what is her problem? Yes, she's experiencing features of hyperthyroidism. Clinical features include weight loss despite increased appetite. They may have heat tolerance, and they may have menstrual disturbances, tremors, diarrhea, etc. So answer for question number 3 is hyperthyroidism. So answer is C. Question number 4. A 27-year-old woman has weight gain and hirsutism. She is also clinically depressed, and she has a history of hypertension. So weight gain and hirsutism, these are all commonly seen in Cushing's syndrome. In Cushing's syndrome, these are all seen. And the other important feature is a lot of patients who have Cushing's syndrome also have depression and hypertension. All these are additional features seen in Cushing's syndrome. So answer for 4 is B, Cushing's disease. EMI theme 5, infectious diseases and psychiatry. Question number 1. A 55-year-old gentleman has developed psychotic depression. He has paresthesia involving both legs and also has high stepping gait and pupil abnormalities. So what do you think is the diagnosis? This is a case of syphilis. Case 1 is syphilis caused by Treponema pallidum. Okay. High stepping gait as well as pupil abnormalities are features of complicated syphilis infection. So answer for 1 is F, Treponema pallidum. Okay. So such patients can present with high stepping gait and they may also have pupil abnormalities, also called as Argyll-Robertson pupil. So answer for 1 is F. Question number 2. A man who works in the United States reports intense fatigue and musculoskeletal pain. Initially, he was diagnosed to have fibromyalgia. He now reports a rash somewhere in his trunk with a bull's eye-like central reddish spot. This does not respond to topical preparations. So what do you think is the diagnosis? This is a case of Lyme disease. Lyme disease is caused by Borrelia burgdorferi, also called as borreliosis. So answer for 2 is G, borreliosis. In Lyme disease is usually transmitted via wooden tick bite, which normally lives on deers. A red spot initially develops around the location. This will develop a central clearing, which is called erythema migrans, within 4 weeks. But 10 to 15% of these patients can develop neuroborreliosis, where they can also present with behavioral and psychiatric symptoms. So answer for question number 2 is D, borreliosis. This type of erythema migrans does not respond to topical preparations. Question number 3. A 50-year-old gentleman with fever, amnesia, aphasia, weakness, wandering, and is now admitted to A&E with vivid and colorful hallucinations. So what is this diagnosis? This is the case of herpes simplex encephalitis. So fairly abrupt onset confusion, memory impairment, fever, psychiatric disturbances, which includes hallucinations. All these are seen in patients who have herpes simplex encephalitis. So answer for 3 is H. Question number 4. A 36-year-old gentleman who is an intravenous drug user is now presenting with mental slowness, loss of concentration, and fascious mood. What is this case? This case is HIV encephalopathy. Okay. So IV drug abuser is a clue. So in this condition, the patient can present with cognitive symptoms that includes forgetfulness, mental slowness, loss of concentration, reduced performance. Fascious mood is also a finding seen in HIV encephalopathy. So answer for 4 is J, HIV. Next theme, medical drugs in psychiatry. Question number 1. A 74-year-old gentleman develops, being treated for resting tremors, develops acute confusional state with paranoia and visual hallucinations. So what is the drug which can cause paranoia as well as visual hallucinations? So this gentleman probably has got Parkinson's disease, treated on levodopa. Levodopa is associated with high rates of visual hallucinations. Other side effects of levodopa include psychosis, confusion, depression, insomnia, and abnormal dreams. So answer for question number 1 is B. Question number 2. A 67-year-old lady taking treatment for swollen legs complains of visual halos, which are green in color, and she appears to be confused. So this case is a woman who probably has got a cardiac failure. Okay? The clues are swollen legs, so probably she has got a cardiac failure, and people take digoxin. Digoxin is given for treatment of cardiac failure. The side effects of digoxin include changes in vision, including seeing a halo or light around objects. Seeing a halo or light around objects is seen with digoxin. So the correct answer for question number 2 is D. Question number 3. A 56-year-old lady on treatment for polymyalgia rheumatica becomes hypomanic and confused. So in terms of treatment for polymyalgia rheumatica, patients are often treated with corticosteroids. So corticosteroids can precipitate mania, hypomania, and also confusion. So among the list here, the corticosteroids is I. Prednisolone could be used for treatment of polymyalgia rheumatica, and patients can develop hypomania and confusion. The answer for 3 is I. Prednisolone. Question number 4. A 79-year-old man treated for ventricular tachycardia became confused, agitated, and presented with paranoid delusions. So, ventricular tachycardia, amiodarone is one drug. Amiodarone is a drug which is used for treatment of refractory ventricular tachycardia.